The renal blood flow, it says that the left renal vein receives two additional veins, the left suprarenal and left gonadal veins. If we take a look at this image over here, then we have this is the left kidney, this is the right kidney. Okay, so and quite obvious that this left side, let me use the right color, this left renal vein is getting two more veins. The first one is the left adrenal vein, that is the left suprarenal, is coming up into downward towards the left renal vein, and the other one is the left gonadal vein is coming from below to reaching the left renal vein over here. So these are the two additional veins in the left renal vein, while the right side, this is the right renal vein, is only getting its origins from the kidney itself and not from superior or inferior. So this is it. And then the renal medulla receives significantly less blood flow than the renal cortex, and so we know that the outside part of the kidney is called the cortex and the inner side is called the medulla. So the cortex is not getting as much blood supply as the medulla. That's why actually the medulla over here, it's this blue color, is not getting much blood supply as the outer cortex, where we see all of these teeny tiny blood vessels. So this makes the inner side, the medulla, more sensitive to hypoxia because it doesn't have enough blood supply to compensate for hypoxia as in the cortex. So that what makes the medulla very sensitive to hypoxia, and of course vulnerable to ischemic changes. That why we consider the kidneys as end organs, because any problem to these may lead to permanent damage. Left kidney is taken during, well, the left side, the left kidney on the left side of the body is the one that is taken during living donor transplantation, and that is because it has a longer renal vein. And the reason for that is, so this is the left kidney over here. Go ahead. This is the left kidney. So this is the left kidney, and here is the vena cava. So it takes more space for the renal vein to get to the vena cava than does the right renal vein. So there is this space difference makes the left renal vein much more, well, not much more, but actually just a little bit longer. That's why we take this left kidney to the rescue of another patient. Well, for the blood supply here, okay, so this is the kidney. This is where we need to filtrate the blood, and the blood, of course, comes from the aorta, abdominal aorta. This abdominal aorta brings its blood supply as the renal artery to the kidney. So blood flows into the into the renal artery that separates into different parts. The first smaller segments or parts or yeah, are called segmental arteries. So this is segmental artery. It's just few more segments of the renal artery coming off the renal artery is segmental artery. Then it's called interlobar artery when it's, goes around the pyramids over here. So this is the interlobar artery, and then to the outside, closer to the cortex, is called arcuate artery. The smaller parts or divisions, and then the teeny tiny divisions are called interlobular artery, and these are the very very small parts. So what is happening is that these teeny tiny interlobar arteries end up having being called arterioles, and these arteries, so this is the interlobar artery, it's this magnified over here. So this interlobar artery has some arteriole coming out of it called afferent artery. So with A, this A means this arteriole is going into the glomerulus. So what is happening in the glomerulus, that is covered by the Bowman capsule. This is the place where the blood filtration occurs, and the nutrients and waste products go from the glomerulus into the Bowman capsule, and then just keep going through these collecting ducts until like they reach their final destination, and that is the collecting ducts. And the collecting ducts next to its brother and its brother and its brother, all of these are collecting ducts. They end up making ureters. and ureters go into the bladder and everything else. So what is happening is that when blood flow, okay, do this. So when blood is going through the afferent arteriole, it's just the afferent arteriole keeps moving in a circular motion over here, or whatever it's called. So it's making a corpuscle over here, and then the blood goes out. It goes out as efferent arteriole, so it is the part that is going outside of the glomerulus, but then it doesn't go away too far. It just keeps moving around these collecting ducts. It's because we still need to reabsorb some of the nutrients that flew out through here, because we still need them. And at the same time, these efferent arterioles just as well wants to keep secreting stuff into these collecting tubules. So this reabsorption or secretion process takes place over here. And then after all of this secretion, reabsorption stuff and everything, is it's going back to end up for this efferent arteriole, the arteriole that went out of the glomerulus, to end up being or attaching to the venule. And then the whole process starts to get larger now, because the venule is attached to the interlobular artery. It is this blue teeny tiny part right next to, so there, over here was the glomerulus, over here glomerulus, and over here so many glomeruluses all over the um, kidney. But then the venules next to its other venule, and then other venule make up interlobular vein, and the interlobular vein with its brothers make the arcuate veins. So these are the arcuate veins, and the arcuate veins end up interlobular arteries, and these are interlobular arteries, and then it all ends up being renal vein. Well, something to know that we don't have segmental vein. Mm-mm. Just interlobar veins and then renal veins, and that's it. We end up being a renal vein going into the vena cava. Okay. So for the glomerular anatomy, we have over here is clear up all of this. So this is the afferent arteriole. The blood keeps flowing in this direction, and then it folds within the glomerular cavity. So and then it goes out the glomerulus as the efferent arteriole. So going in is called afferent, going out is called efferent, and then blood keeps flowing this direction until it goes to the outside. And what is happening here is that blood is filtrating through these penetrations, because we know all of these are endothelial cells, and these endothelial cells, they just filtrate the blood through them, and so the blood encounter the basement membrane. It is this line over here. So this is the second barrier they will face, the filtrates will face, until reaching the third part that they're going to face, the third barrier, and that is the podocytes. The podocytes are components of the Bowman's capsule, and then by filtrating through them, the filtrates end up being collecting and goes through the proximal convolute tubule and the other tubules over there. So we have here an important structure due to close proximity between the afferent arteriole and the distal convoluted tubule. This is a collecting tubule that has urine inside of it. Between them, there's an important structure called the juxtaglomerular cells. These are the cells that are responsible for producing renin, and that is going to be have a lot of hormonal effects. And also macula densa. These are very important cells in recognizing. As I think the blood pressure, or is something that we'll talk about later. We'll see there, I guess. So this is the histology look. So this is an afferent arteriole. So this is an arteriole coming in the glomerulus, and it's keep moving like this, and of course facing the Bowman capsule. This outside coverage is the Bowman capsule, and all of this filtration is going this way. Okay, until this afferent um, arteriole that we have here is going to pass all of this and just go outside as efferent arteriole. And of course, we have this teeny tiny cells. These are the macula densa that we just talked about. These are the macula densa, and that's it for this image. Just because it's colored, we have the macula densa over here. We have the bowman. This big, huge thing is the macula densa. This is the Bowman's capsule, and we have the capillaries. They just keep moving inside the glomerulus until they go out. And these are the parietal blades of Bowman's capsule. So Bowman's capsule has its own parietal layer. We have now the course of ureters. So the course of ureters, they arise from renal pelvis, and they travel under gonadal arteries, over the common iliac artery, and then under uterine artery or vas deferens, that is in the retroperitoneal part. So these are the ureters. So this yellow thing is the ureter, okay, and then it flows from the renal pelvis under gonadal arteries. So these are the gonadal arteries. So this is the left gonadal artery over here, this red thing. So as we see is the ureter going below the the gonadal artery, and then it goes above the common iliac artery. This is the red huge thing is the common iliac artery, and then the ureters keep going down till they reach the vesicle, but then they encounter going below the uterine artery in female, or in male it's vas deferens. And this is the uterine artery. Okay, so in gynecological procedures, ligation of uterine or ovarian vessels may damage the ureter and leading to urethral obstruction or leak. That is by mistake, because we're ligating this, so we are ligating the urinary ureter by mistake. Ending up as obstruction. Bladder contraction compresses the intramural ureters, preventing urine reflex. Well, we know that this bladder is consisting of a muscular muscle, and this muscle, if it just muscular wall, I mean, and if this muscle contracts, then of course it's closing the opening within it, the ureter opening within it, so preventing the backflow of urine into the kidneys. So the blood supply to the renals, there are three main parts: proximal, middle, and distal. So the proximal part of the, let me see over here. The proximal part of the ureter is supplied by the renal arteries over here. So this is the proximal part, and there you go. It has its own blood supply from the renal artery, while the middle part gets its blood supply from the gonadal artery, aorta, and common internal iliac arteries. So this is the middle part, and it gets its blood supply from the aorta, common iliac arteries, and what did you say before? Gonadal artery, aorta, and common and internal iliac arteries. So, and this is the internal iliac artery and common. This huge thing is the common. So yes, it makes a lot of sense, because there you go. Blood supplies from here. And then distal, it gets its own blood supply from internal iliac artery only and superior vesical arteries. It gets it from, this is the internal iliac artery, right? Yep, yep. This is the internal iliac artery, and then also the superior vesical artery over here. Okay, so that's nice. That's for the distal part of the ureter, and then we have three common points of urethral obstruction. These are the ureteric pelvic junction, pelvic inlet, and uretrovesical junction. So three common places for the ureter to get obstructed. The first one is the attachments between the ureter itself and the renal pelvis. This is the renal pelvis up here, close to the kidney. So it's the huge collecting part of the kidney, and then this area of attachment is a place for the obstruction to happen, and also the pelvic inlet. So it's where the ureter goes into the pelvis, and then we have the vesico uretral junction, the insertion of the ureters into the bladder. So in order to memorize it, so what are you, that is, these are the ureters. They flow over the iliacs and under the bridge. So the uterine artery or vas deferens. What we have over here is that okay. So this is a male section and this is a female section. We know that what makes up the wall of the bladder is the detrusor muscle. It's a muscular wall. So when it contracts, it pushes the urine to the outside of the body, and at the same time it closes the openings of the ureters. And we can tell that the ureters they open up in the bladder from the behind, like not from top but actually from behind, from the back. And we can see that the ureters go below the vas deferens in male and go also below the uterine artery in females. And then there is the median umbilical ligament attaching the bladder so it does not fall. We have this called trigon. It's this three-sided place where the urethral orifices open, and then this is the opening of the urethral orifice where urine goes out. If it's a male, this is where the prostate is. That should be it.